Hi, welcome to my video. I will be tackling the topic of antibacterial overuse. And is it bad? So you might ask, what are they? From the Access Science database, it is summarized that antimicrobial agents, or antibiotics, are biosynthetically or synthetically produced chemical compounds that can selectively destroy harmful microbes or suppress their growth. Depending on the type of microbe that is attacked, these compounds can be classified as antibacterial, antifungal, antiparasitic, or antiviral agents. Alexander Fleming discovered the first and one of the most common antibiotics, penicillin, in 1928. What are antibiotics used for? Well, as I found on WebMD, it can treat a large variety of illnesses such as bronchitis, pneumonia, strep throat, ear infections, pink eye, urinary infections, skin infections, and many others. A sickness can most likely be treated with antibiotics as long as the illness was caused by bacteria. Additionally, there are over 100 types of antibiotics, but the broad spectrum ones are aminoglycoside antibiotics, cephalosporin antibiotics, macrolide antibiotics, penicillin antibiotics, quinolone antibiotics, and tetracycline antibiotics. Antibiotics can kill or inhibit the growth of bacteria in different ways. Penicillin works by breaking down cell walls, killing bacteria, and preventing growth. Erythromycin and neomycin, on the other hand, stop protein synthesis inside the bacteria cell, which is a basic necessity for all living organisms. Finally, antibiotics like ciprofloxacin bind to DNA enzymes, inhibiting DNA replication, which stops cell mitosis so it cannot divide and grow. Antibiotics are used all over the world today, and the demand has increased by a dangerous amount. Many people visit a doctor expecting to leave with antibiotics, even if it could be treated with over-the-counter medicines. This has led to antibacterial overuse all across the world. Additionally, antibacterial overuse can cause bacteria to gain a tolerance for medicines and ultimately lead to a worldwide epidemic. Well, what is resistance? According to Access Science database, antimicrobial resistance is the capability that a microbial pathogen, for example, a bacterium, virus, parasite, or fungus, acquires to counteract an inhibitory molecule or compound that was formerly effective in killing or preventing its growth. You now may be asking, are there any side effects or anything bad if I take antibiotics when it's not needed? Well, yes. According to Mayo Clinic, if you take an antibiotic when you actually have a viral infection, the antibiotic is still attacking bacteria in your body, but the bacteria is either beneficial to you or at least not causing disease. This misdirected treatment can then promote antibiotic resistance properties in harmless bacteria that can be shared with other bacteria and ultimately make you a perfect target for a superbug. A superbug cannot be controlled even with a variety of drugs, which means they can be especially deadly. In fact, each year in the United States, at least 2 million people acquire serious antibiotic-resistant infections that are so resistant that at least 2 or more antibiotics designed to treat those infections don't work. Also, at least 23,000 people die as a result of these infections. Additionally, every human has bacteria in and on their body. After you take an antibiotic, most bad bacteria is killed off, but some bacteria survive and evolve, and the next time they encounter that drug, it might not work. This is the birth of the antibiotic-resistant bacteria, which now lives in your system. This bacteria can now be shared with people while doing day-to-day activities. As the bacteria circulates, they can become resistant to multiple antibiotics, which can cause infections when you get a cut or a weakened immune system. Now, if a similar antibiotic is used, it might not even have an effect. And when doctors use multiple antibiotics and they also don't work, that is when you know you have a superbug. Whether you take antibiotics once a year, or you are constantly finding yourself in a never-ending cycle of being sick and getting antibiotics, you should make sure you are absolutely in need of it and have tried alternative options before putting your body at risk. Is antimicrobial overuse bad? Well, I hope you can now answer this question for yourself.